Shall I recognize the honorable member for Marco City?
Mr. Speaker, I rise on behalf of the good people of the Marco City constituency to make my contribution in respect of this bill. Sometimes, Mr. Speaker, I wonder, based on the debates that happen in this House, whether there's not a disconnect between what happens here and what is happening in the country. And I worry sometimes that the people do not understand what we're doing in relationship to the experiences that they're living. And so my contribution in respect of this bill will try to bring some clarity and my own concept of clarity to what this bill is about and what it's not. Mr. Speaker, while I speak in this House, I remember from 2012 saying that I'm so grateful to be able to speak on behalf of the good people of the Marco City constituency. The time is winding down in this House. I want to spend a minute on that. Mr. Speaker, I have had the uninvited role, but nonetheless happily embraced role, of speaking my mind in this House in the context that I understood it to be for the good of the people. And it's been a trying experience. And I am so grateful for Marco City. They have shown such tremendous support that I am humbled by it. And so in making my contribution on this bill, Mr. Speaker, I'll try to continue in that role to bring as much clarity as I can to what I understand the bill to be about and what it's not about, and to invite a different course. Mr. Speaker, let me start by saying this. This bill is not about universal health care. I've heard both sides speak, and they speak of it as if it's about universal health care. This is a fiscal reform bill. If we think this is a bill about universal health care, what we're actually saying is that one of the four pillars that Sir Lyndon strove for, that the PLP helped to build this country on, never happened. That's what we're saying, if we believe this bill is about universal health care. And I keep repeating, those four pillars are very clear. Those four pillars were to take our people from where they were in a state of deprivation and victimization and bring them to a place of true citizenship and a right to participate in the benefits of this country. Those four pillars are and always were access to health care, access to education, access to jobs, good paying jobs, and access to housing. I've made my contributions on a couple of those others during the course of various debates in this House. But this debate is about access to health care, which was settled by the first independence government in this country decades ago. In fact, we are beyond most of the countries in the world in terms of access to health care. We provided universal health care as a part of our independence package. We took the position that in the public package of taxes, separate and apart from any premiums charged to any individuals, we will provide for universal health care as a given, as an entitlement, as a right, and not as a privilege to our people. We decided that we would build a public health care system throughout our country where our people would be able to access health care in the same way that they were able after independence to access education. Free of charge, but at their election. With the understanding that if people wanted to go into the private market for health care or in the private market for education, they could do so. But as an impediment, as a requirement of the government, as a commitment to our people and our democracy, we would provide public education and public health care. This is these were two of the four foundations we built this country on. And we said that health care would therefore be built into the national budget for everyone to access universally before most of the European countries even thought about it. before America even thought about it, and before they still have not arrived at that point. We are far ahead of the game in the world in setting the standard for universal health care. Where we have failed, Mr. Speaker, is that we have allowed our universal health care system, which we call public health care, to become, I'm trying to be polite about this, hybridized by private health care in a public health care system. That's what we allowed. And I've asked the member for Centreville before for the Physicians Alliance Agreement. I refer to the commitment that was made that whatever we asked for we would get. I say to the public right now, I've never seen it. Even though I've asked for it in this house, I've still never received it. But let me say this. Let me say this. Our system is built on this predicate, these two predicates. The first predicate makes absolute sense. We will provide, as an imperative, public health care which is paid for out of the public treasury. It's still paid for by taxes, it's not free, but we will provide it universally to everyone. That was our first commitment. And then we hybridize, bastardize the system by saying we will bring private health care into the public health care facilities. This is what Physicians Alliance is about. We said that we would allow private doctors to practice private medicine using private facilities and private resources for their personal benefit. Public facilities for their personal benefits. And that has happened on both sides of this house. On the PLP side, on the F&M side. People got rich doing that. And as a result, we have this anomaly of private wards in public hospitals. We seem to believe that's normal. That's not normal. That's not normal at all. And what it has led to is the public money being used to create public facilities to enrich, in major part, private doctors at the expense of the public citizens, who are deprived of the bed, the facilities, and the rest of it in the public hospitals they're paying for. Just to put it in context. Hey, Mr. Speaker, let me say this. Before I finish putting this in context, I've been going through a very interesting experience in my life. Very, very interesting experience. I have sat down and deliberated on things I've come into this house and say, and have been, in my opinion, stopped. Not by anyone. Internally. Stopped. And I only interject this because, it is what it is. This is something I have felt strongly, and I'm going to share with the people who are listening. And I believe this is a message for our country before I get back to this debate. I have been sitting down and deciding what I would come to this house and say. And repeatedly, all I'm hearing echoing through my mind is Ezekiel 37, 1 through 14. Echoing and echoing, bothering me. And everyone knows what that's about. Ezekiel is sitting down, Ezekiel is saying, the power of the Lord was upon me. And he said to me, can these dry bones live again? Can these dry bones, and Ezekiel says, I said to him, I don't know, only you know that. And he said, they can live again. Prophesy to these bones and tell them they can live again. And I'm saying this for a purpose. Tell them they can live. And Ezekiel said he did that, and the bones started to attach the bones, and sinews came onto it, and flesh covered it, and then he prophesied breath into it, and it stood up, and it ends with this. And God said, in the same way, tell Israel, I will restore them. I will fix these dry bones. I will put flesh on them. I will breathe in them again, and they will live again. And the reason I believe I've been hearing this, and the reason I'm saying this house, is we need to get to the point where we breathe again into the dry bones that have become this country. Breathe again into empowering our people. To say that we do not now have universal health care, let me repeat this, is to say that one of the four pillars that Sir Lyndon erected never happened. That can't be right. I've made no pretense. Even though I left the PLP, I've made no pretense that my political father is Sir Lyndon Finlay. In terms of philosophy, I've never made a pretense of that. That is to say that, and just to say that puts me at a position where I start to wonder, what are you talking about? So what are we talking about? What is the truth? I said that this bill is about fiscal reform and not about universal health care. Why do I say that? If you look, Mr. Speaker, at the 2015-2016 budget, I'm not going to belabor it and point to this, but everyone can look at it if they want to. We did two things in that budget. When I say we, the government did two things in that budget. They defunded the Ministry of Health. Defunded it. Just defunded it. They took away from they defunded the entire Ministry of Health and projected NHI revenues in 2015-16 at $260 million. They projected it. We're going to raise this in taxes for NHI in the 2015-16 budget. That never happened, so there was a hole in the budget of $260 million. And then they actually incurred, obviously, expenses in the Ministry of Health that are being defunded for another $274 million. Why is that important? Imagine you're running your house and you say to yourself, listen, I know this person is going to pay me this money. He's going to pay me $260. And you say at the same time, look, I didn't get that. He didn't pay me it. But I did incur expenses of $274. You know what you lost? You lost the money you didn't get, and you lost the expenses that you incurred. You lost the $534, or in this context, the $534 million hole in the 2015-16 budget. I'm saying that for a purpose. I'm saying that to say this, that at the end of the day, we have always funded the Ministry of Health. When you get to 2015-16 budget, actual expenditure was $274 million. If you go to the 2015-16 budget and before, you'll see that we always funded the Ministry of Health. People are already paying for the Ministry of Health, which are the public hospitals and public clinics. What we're saying to them now is we're going to not actually wrap them into a new structure, because we're going to look at them, and I'm going to show it in a second, as being administrators under this structure, not as actually transferring the assets over to National Health Insurance, but they're going to become administrators. And what we're saying is the hospital you used to be able to go to, based on your taxes and based on your contributions, you're now going to pay for. That can't be right. That can't be right. If you think about it, people keep asking where VAT went. Think about what I just said. This is where we are. Let's look at the opposite of where we're going. Let's look at where we should be going. We have looked at the national debt increasing in from 2007 to 2012 under the FNM from $3 billion to $5.7 billion. We've looked at the national debt increasing since 2012 to $6.6 billion. I've said before, the government has done a remarkable job of containing the national debt. I've disagreed on the way in which it was contained by VAT, on the back of the poor. But I applaud the fact that it has at least been contained. The downward decline has been lessened, but it's still heading in the wrong direction. We're looking now at 2015-16 of $6.6 billion. We're looking today at a GDP national debt of 76.3% of GDP, which means if you took everything that everyone made in this country and imagine the government owned it all, the national debt is 73.6% of that. But in real terms, when you look at the actual revenue of the government, the national debt is over 3 times the revenue. In real terms. And if you look at the payment down of the national debt, what you will see is that we will spend the next, I don't get in numbers, long foreseeable future trying to pay that down, even if we stop incurring more money. And so we come to NHI. VAT was one way of arresting the national debt. Tax the poor and the middle class to raise more money, significantly more money, in order to be able to deal with the national debt. 2015-16, VAT alone raised $544 million, projected by 16-17 to be $652 million, and approximately $700 million by 17-18. If we were talking about income tax, I'd be here applauding, because that would be a tax on the rich. That's a tax on the poor and the middle class. And that money, as I keep saying, doesn't materialize out of thin air. It comes from somewhere. It comes out of the pocket of the poor and the middle class. And now we are saying, let's do this with NHI. Let's tax healthcare, which we built as an independent country to be included in the budget. Let's tax it a second time by calling it NHI. And now we do it because we create this new structure, NHI, which we're going to tax with. And I'll show you in a minute we are going to tax based on what's been released so far. And in the starting period, we don't tax because we talk only about primary care. But we make it very clear in all documents that we are moving on to tax for secondary and tertiary care. And who does that fall on again? The poor, the working poor, and the middle class.
The ones who need the health care.
This cannot be right. This cannot be right, especially when we have an alternative. And do we have an alternative? Clearly we have an alternative. Tax the rich.
I agree with that.
Tax the rich. It's time to tax the rich. All the international organizations are telling us tax the rich. We have companies leaving this country because we refuse to tax them. And because they're being treated in their home jurisdictions as being in a jurisdiction which supports unfair tax competition. Google the phrase. We have companies leaving this country because we refuse to tax them. We have other companies which essentially, for whom we are essentially writing a check every year to their home countries from our public treasury. We don't actually do it, but the effect is the same because they are generating money here and paying taxes on that money in their home countries, whether it's Canada, US, or Europe. And had they been taxed, they would have gotten a tax break for our taxes that we charge them, and they would have paid less in their home countries. And so essentially what we're doing is saying to them, go pay it all in your home country. Don't give us any cut.
Leave us none.
Parenthetically, Mr. Speaker, that's exactly what we did on Monday. We gave a $2 billion tax break to the people who are richest in Freeport. And I'm bringing it here only to say this pattern continues and continues and continues. And it's unsustainable. It's not only inequitable, it's not only unfair, it's unsustainable for our country. Unsustainable. You know, when I see middle class people, decent people, hard-working people, who've worked all their life, who are not people who come to you and beg for something, coming to me and begging, something is fundamentally wrong with that. Fundamentally wrong with that. And yet we come in this house and we talk back and forth, we throw some mud here and some mud there, and everyone laughs about it and goes down patting each other on the back. And the people are suffering. And this bill will exacerbate that suffering. What's the alternative? The alternative is very simple. We have a universal health care system we call the public hospitals. Take the private doctors out. You now have enough facilities. Stop promoting the private doctors to be in charge of the wards and to make recommendation on what we should purchase. Now you suddenly have MRI machines in a public hospital funded by the public treasury. Instead of sending the public patients from public hospitals to private doctors to make money because those same private doctors head the wards and determine what the government purchases for the public hospitals. How can that be right? How can that be right?
And they send you to themselves.
I fully support the system, both in education and health, for options. I support the system of public education, and those who can afford it, send their children to private education if they wish. I support the system of public hospitals, and those who can afford it, go to private doctors if they wish. I do not support the system of essentially double taxing the people for public hospitals. This can't be right. Do we need people to march in the street before we understand the pain that they're suffering? Do we need people to suddenly leave their faith, which has kept this country so strong for so long, and and forget to say God will work it out and take it into their own hands? There is pain.
Yes.
I've been saying this for 4 years. There is pain
Say it again, my brother.
in our country, and we are not feeling it. We are sitting in this insulated place, passing laws and not thinking about how it affects our people. You come in this house and you say you raised $600 million of VAT, and you forget to say who you took it from, who you got it from, who is suffering, and they were suffering before, and now they have $600 million less in their pocket, and now you want to do the same thing with NHI? How can this be right? And what is the alternative? The alternative, as I said, is to tax the rich. You know the problem with that alternative, Mr. Speaker? We are the rich.
The insurance companies are the rich.
We were not in 1967, but now we are. We sit in this house in a representative democracy, representing people who feel what we do not feel. And we are making laws that are comfortable for us and not for them. We are making a law that will affect the employees who work for me more than it affects me. We made a law with VAT where they are paying more taxes than I'm paying. How can that be right? How can that be right? Yeah, I hear people making these statements that everyone pay the same VAT. And to make sure the people in the country do not fall for that ignorance, let me make sure the people understand it.
Members,
Let me make sure the people understand it. If you pay VAT, which is a consumption tax, you're only paying it on what you consume. Not on what you keep in the bank, you know, not on what you make. And so how much food can I eat? How much gas can I use? How many drinks can I drink? Not as much proportionately as my income would allow me to. And so you have a person goes and pay, I go buy a can of corned beef, and my secretary buys a can of corned beef. We pay the same VAT, but I have far more money than her. How is this right? And it leads to this point. Why are we doing this? And the answer is very simple. Because we do not want to tax ourselves. Tax is about revenue. The foreigners in this country want to be taxed. It makes no difference to them. None. Because they get an exemption in their home jurisdictions where they pay to us. But what do? We say, oh, we don't want to tax you because if we tax you, we got to tax ourselves. And now, not only are we paying money, but the country gets to see where we get our money. I keep saying, income tax is not just a revenue tool. Income tax is an anti-corruption tool. An anti-corruption tool. And we sit in this house and we say day in and day out, we will not do what our country obviously needs. And we do it for our benefit at the expense of the people we supposedly represent. Mr. Speaker, I've done the general thing, so let me do the specific thing in my 7 minutes. For those who don't believe you're about to get taxed, look at the publication from NHI Bahamas. Look at page 9 of it. Look at the middle, look at the second paragraph, and read this. Primary care referrals for selected specialized non-primary care procedures and services will be covered by a special fund. No one pays in the beginning. Special fund. Special fund just means your money you paid in taxes allocated to this. Now, it doesn't materialize out of thin air, it's still your money. But it goes on to say this. An expanded benefits package will be implemented once other health system strengthening activities have advanced and the healthcare system is ready for full implementation. So you get more benefits. Keep reading. When NHI Bahamas coverage expands to include additional services, secondary care and tertiary care, public funding will be supplemented by new sources of revenue. What do you think revenue means? Revenue means taxes. In other words, when you go through this bill, and I'm limited in time, so I'm not sure how much I can go through. But when you go through this bill, what you will find is this. There are 3 levels of services: primary, secondary, and tertiary. Primary just means outpatient care. That's all that's provided for under the bill. All. The minister may add other levels of care, secondary and tertiary, and the minister may add fees for those other levels of care. That's what it says. Fees means taxes. And it goes on to say, and this one I don't even know if it's constitutional, but we'll have a debate on this at some point. Regulations may be made, not by this parliament, but by the minister, to provide for who pays those fees, employers or employees. Employers or employees. And the public should not be fooled by this. When you pass, the same thing I said under the petroleum bill. Delegating all these powers to ministers and letting them table regulations in the House is not the same as debating and passing acts. Tabling regulations, we have no say-so on that. You just table it, and it's law. No debate, no amendments, no anything. This is the Trojan horse. This is to bring in the first phase, which is primary health care, and to give the authority to bring in the second and third phase, secondary and tertiary health care, which is the real medicine, and to bring in fees at the same time. And you know, Mr. Speaker, what is very interesting? Very, very interesting, and I have to do this in a way that is different than I had intended to do it. But what's very interesting is this idea of bringing in other phases includes the idea of licensing health administrators. Sounds okay so far. And the health administrator may be a Section 24, a company whether wholly or partly owned by the government. What is that? Which administrator exists in this country that's wholly or partly owned by the government? Other than the Public Hospital Authority. Which administrator? Tell me. So you know what's interesting about this? This whole bill never once mentions the Public Hospital Authority or the Public Hospital Authority Act. Never. It doesn't make the obvious link that you cannot create a second structure without dealing with and tagging it into the first. But it does it in that little surreptitious, clandestine way, that they will be brought in as an administrator. Administrator. And then you pay a fee. And then we'll tell our people, based on regulations we will never debate.
That's right.
We will tell our people, you know the public hospital you used to have? You know the ones that Lyndon went and put in place? You know the one your parents and grandparents struggled and had cookouts and died for? That one? You're paying for that now. And the taxes you were paying before, we're not getting rid of them. We're not rebating them. We're going to make you pay twice. I mean, I marvel about this place. I marvel. You know, I have right here, Mr. Speaker, this. It's almost like a Bible to me. The life and times of Sir Lyndon, almost like a Bible to me. It's not a Bible, so don't go saying I'm worshipping that. It's almost. It's almost. And I keep going to it. Not because I worship Sir Lyndon, you know, but because I understand when we started this in '67, we had this right. That is when we, all of us, were on the same page. So what's happened? What's happened? Those who doubt that employers will have to pay the tax, those who doubt that, I'm going to do this very quick. Those who doubt that there will be taxes, look at Section 11(1)(d) and Section 24. Those who doubt that employers will have to pay for it, look at Section 23(1), 23(3), and 23(4). Look at them. Those who doubt that secondary and tertiary care will come in with taxes, look at 20 sub 3 and 20 sub 2.
Go ahead, Greg.
Those who doubt that Bahamians will be a force to access private care providers instead of public care facilities, look at Section 3C. And look at the concept of plurality in healthcare system as one of the mandates of the National Health Insurance Bill. Look at it. And those who doubt that if you don't register and get into this, you're not going into the public hospitals anymore, look at Sections 18(1) and 18(2). And look at the definition of eligible people. And expressly them saying access to health care will only be available to eligible persons who have registered.
I tell you, speak loud so the Bahamian people can hear you, yeah?
You know what? I'm at 1 minute and 15 seconds with Speaker, so let me just say this.
Signed on to the Convention for Human Rights.
We came here. I know why I came here. I know why I came to this house. I came here to speak for the people. And I promise the people, without fear and without favor, I will speak for them.
Members?
I did not come here to be a part of dismantling the public health care system under the guise of national health insurance.
Amen.
I am fully for dealing with the public health care system, maximizing it, properly equipping it, properly staffing it, and most importantly, getting with existing revenue and getting the private doctors out so our people are able to enjoy the facility they're paying for with their money already. I'm not for this. I'm not for this. And you could color it any color you want, it ends up being the same thing.
Obligation to join the
You
Bahamas.
have almost $300 million a year for healthcare already under the existing system.
When you talk-
Already. Do not balance the fiscal budget on the back of the people's health. Marco City doesn't support this, Mr. Speaker.
Amen. You do good.
Thank you.